What are the various ways to diagnose if you have a breast cancer? There are various diagnostic tools that can help us determine if we have breast cancer. Beginning with the easiest and the simplest one, it is the self-examination of the breast that we can perform on our own at our home. So what we do is, with the 3 fingers, we press our breast, we put a firm pressure on our breast to check for any lumps that we can feel, or visually check if there is any appearance, change in skin texture or size or shape that we can locate on our own. Also, the second is the clinical evaluation. Because self-examination is important, but it does not give us an assurity that it is enough. So that is why we recommend that you must visit a consultant once in a while to get your breast evaluated clinically. What a clinician does is, they evaluate the breast for you by touching if there is any lump that they can feel or if there are any other symptoms that they can probably see in you. So the next thing that they suggest is a mammogram. So the mammography is another routine investigation that is needed for you, because mammogram is a low-dose X-ray that gives you an image where you can localize if there is any lesion present in your breast. Similar to mammogram is the breast MRI that uses radio waves and probably magnets to depict a picture. The same is with the ultrasound that uses a sound energy to create a picture. So if there is any lump, we can definitely locate the lump and we can also find out the size of the lump. It can also help us determine if it is cancerous or non-cancerous. So PET scan is another important diagnostic test. PET scan also uses some tracer radioactive material to locate your cancer. It gives a brighter image of the cancerous lesion in the scan. Also, there is biopsy. In biopsy, what we do is we use a fine needle to take out a part of your breast tissue and observe it under microscope to check for any abnormality that it can be seen. So breast biopsy plays a very important role, as it gives an accurate diagnosis and it tells us if the lump that you have in your breast or if the lesion that you have in your breast is cancerous or non-cancerous. So these are few very important tests that are needed to diagnose if you have breast cancer. So it comes out to be self-examination, clinical evaluation, mammography, breast MRI, breast ultrasound, PET scan and biopsy. Genetic screening also plays a very important role, as it gives us an information about the gene mutations, if there are any inherited gene mutations like BRCA1 and BRCA2 genes. So all of these diagnostic tests are equally important, and it completely depends on your doctor of which test he needs to get it done for you, depending on the symptoms that you are showing or depending on the clinical evaluation. So diagnosis is important. The diagnostic test can vary from one person to another, but it is very important for you to get diagnosed at the earliest, to get treated at the earliest. So you should definitely focus on the diagnosis.